talking a moment ago about working federal, state, local officials in Minneapolis. Governor Walz's office is saying today that he's trying to get a hold directly with the president. Have they spoken? And if they haven't, why haven't they spoken? If there's a desire from Walz, as they're saying, to de-escalate what's happening there.
I'm not sure if that's a genuine offer to speak with the president. I was with the president about 30 minutes ago and they hadn't spoken at that point. Look, the president is always willing to answer the phone when people pick up and call. When there was another tragic shooting many months ago in Governor Walz's state, he spoke directly with the governor. I would ask that the governor stops inciting the harassment and illegal obstruction of law enforcement in his state. All ICE and federal law enforcement are trying to do are remove people like this off of the streets of Governor Walz's city in Minneapolis and of his state in Minnesota. If you look at some of the individuals in this photo, these are all illegal alien criminals who came into our country under the previous administration. This is some of the most disturbing crimes you will ever read about, and there's only a few reporters in this room who will actually talk about these individuals. This is all ICE is trying to do. They are trying to remove people like this from Governor Walz's state. And so yes, he should pick up the phone and he should say that he will cooperate with this president and with the federal government in making Minnesota safer, because that's all President Trump and his administration want to do.
The president says he wants money to go directly to Americans so they can buy their own insurance. How exactly would this work? And can the president assure Americans that this will be enough to cover their health care costs?
So this is the second principle in the president's health care plan, lowering insurance premiums specifically and ensuring that that money is going directly back to the American people and cutting the kickbacks that then raise those premiums. So this plan, once put into legislative text and passed by Congress and sent to the president's desk, will stop sending big insurance companies billions of an extra taxpayer-funded subsidy payments and instead send that money directly to eligible Americans to allow them to buy the health insurance of their choice through, you may have heard it be referred to as health savings accounts. Whether that ends up being the actual name of such accounts, we'll have to see. Again, Congress and the White House are going to work together to put this plan into action. And then secondly, the Great Healthcare Plan will fund a cost-sharing reduction program for healthcare plans, which will save taxpayers at least $36 billion and reduce the most common Obamacare plan premiums by over 10%, and that's according to the Congressional Budget Office.
But 20 million Americans in recent weeks have seen their healthcare costs soar. Can he assure them that if this plan is put in place, that they will be able to cover those costs?
If this plan is put in place, every single American who has health care in the United States will see lower costs as a result. They will see more transparency. All of these proposals that are within the Great Healthcare Plan are incredibly popular with the American people, and they will impact everyone, not just a small fraction of those who are within the healthcare marketplace, but every single American will continue to see their costs go down.
Hey, thank you for watching this on CNBC TV 18. Hope you liked it. For more such interesting news and updates, follow CNBC TV 18 on all the social media platforms.